Hi everyone, my name is Rushil Jain, and today I will be presenting on challenges and disparities in healthcare with respect to hospitals in low-income settings. So a little bit about me. My name is Rushil Jain, and I'm going to be a rising senior at Basis Scottsdale in Scottsdale, Arizona. My whole family is from India, and some of my research and interests and passions include biology and medicine. I'm especially interested in sports medicine, emergency medicine, and pediatrics, and I aspire to attend medical school in the near future and hopefully become a physician. In terms of my extracurricular activities, these include hospital volunteering, participating in an anatomy and dissection STEM internship this past summer, as well as a research internship with a college professor. I'm also part of Honor Health's Medical Explorers Club, and earlier this year, I founded a club called Exploring Emergency Medicine at my school, and I also enjoy playing the acoustic guitar in my free time. So just a bit about introduction to disparities in healthcare. So common stereotypes in today's society exist regarding how hospitals and physicians are able to help individuals who suffer from sickness, injuries, and other medical complications. However, this is overgeneralized. Not much consideration is being taken into those who reside in low-income or underdeveloped areas. What about the minorities? Such individuals face lack of transportation and insurance problems. There's also a fear factor. What about other resources like water and electricity to help properly sustain hospitals? In the current day, many hospitals around the world, especially in low-income and rural settings, are not properly equipped with the necessary resources to effectively and efficiently serve patients in need. As a result, without the access to these necessary resources, hospitals are unable to accurately treat health-related problems due to these financial reasons, such as the lack of water and electricity. And this causes global health to be negatively affected overall, since without proper care and support, the overall health of individuals will start to decline. Additionally, common stereotypes and generalizations exist regarding how hospitals are seen as life-saving centers with common mission and value statements, including the emphasis on providing patients with the best care possible. As a result, it is crucial to take immediate action now to equip hospitals around the world with proper resources and financial means to properly effectively provide quality care to patients and to support patients post-treatment, especially in these poor, underdeveloped socioeconomic and rural regions. In rural regions, individuals with low income were 7.4% more likely to experience a lack of primary care physicians compared to their wealthier counterparts in urban areas, for example. Furthermore, as of 2010, in just the United States of America, approximately 85 rural hospitals have been shut down. So in terms of comparing hospitals in rural and low-income areas versus urban areas around the world, we need to compare the differences between private and government or public-run hospitals. So public hospitals in developed countries, such as the United States, are often more inclusive in terms of monetary cost and offering more flexibility for patients, while private medical institutions are aimed towards more costly yet personalized care, according to Worcester Community Hospital. In rural areas, however, the lack of population to effectively and efficiently sustain local hospitals further contributes to this poor healthcare service. There is also the lack of public trust concerning the quality of care available at their local rural hospitals. And this leads to the increase in travel time to obtain care from perhaps a different healthcare institution. And this also brings out the importance of the reputation and efficiency behind a hospital. So what are the problems facing public and government-run hospitals in rural and low-income regions? So we need to consider about resources such as water and electricity to properly sustain the operations of a healthcare clinic or hospital. For example, in Chennai, India, water for surgery needed to be brought from private companies in order to properly perform surgical operations. There is also lack of medical colleges in India due to land requirements in rural areas. Furthermore, in rural areas around the world, the aging population of healthcare workers leading to retirements, as well as long shifts leading to fatigue, further contributes to staff shortages in several of these rural areas. So now focusing on declining infrastructure and increasing disparities in healthcare, many healthcare providers and institutions in rural underserved areas are closing permanently. And this includes a combination of several factors, as previously mentioned. including staff shortage, patient distrust, and the availability of other healthcare clinics. For those in remote rural areas, especially those with poor financial standing, a trip to access proper healthcare, even in rural settings, is not even close to affordable. And as a result, we see a higher prevalence of disease and sickness in rural populations. In terms of post-treatment in rural hospitals, we see how 19% of the United States population resides in rural areas, according to JAMA Network. In terms of post-acute care, we see how patients in rural areas were more likely to receive Medicare, 18.2% compared with 13.7% in urban counties. Furthermore, patients in rural areas were more likely to undergo hospitalization due to diseases such as pneumonia. We see that with 32.2% in urban non-adjacent rural counties versus only 25.4% in urban counties. So here we see a study from JAMA Network, and we are basically comparing patients in urban versus rural settings, which is broken apart into urban adjacent locations as well as urban non-adjacent locations for rural areas. We are able to see characteristics such as age, as well as the location. And an important part to see here is the primary diagnosis with respect to different diseases such as pneumonia and complications such as heart failure, stroke. And we also see the differences in ICU admission and the length of stay, which reflects upon the poor infrastructure for many healthcare institutions in these rural areas compared to their urban counterparts. So, what next? In terms of these challenges and disparities in healthcare and for hospitals in low-income and rural settings. So in the current day, many individuals in rural populations around the world are constantly experiencing the lack of quality healthcare due to several socioeconomic and financial factors in their community. And as a result, we need to address the significance of the existing disparity in the current day, as well as its future implications. So many claim today that our world is modernizing and advancing, especially in terms of new medical technologies and breakthroughs. However, little to no attention is being placed on healthcare providers and healthcare institutions in these rural and low-income settings. As a result, this problem is only going to grow, fueled by the lack of inattention. The only way to help ensure that everyone receives equal access to healthcare, regardless of the location and finances, is to direct action now. So what can we do as a community? So we can address government support, citizen contribution, as well as reaching out to medical professionals. So in terms of our current generation, as teenagers in high school, we can discuss ways to start addressing this issue at the local, regional, national, and international levels. Such ways can include transporting aid and supplies to hospitals through donation drives, contacting government representatives to determine ways to provide hospitals with financial support, as well as working together with organizations such as the National Rural Health Association. We must ask ourselves this question. If one of our loved ones was experiencing such disparities and challenges in healthcare, what would you do to help them and their surrounding community? Attached are a list of references that I used throughout my presentation. I would like to address big thank you to the Global Health Leaders Conference at Johns Hopkins University for providing me with this amazing opportunity to present on this topic. And thank you everyone for listening and devoting your important time to help make a positive impact on our community by learning about these inequalities in global health with respect to hospitals and low-income settings. I would like to also thank my parents and family for supporting me throughout this process. And I'm grateful for these organizations for providing me with reputable and insightful resources to further my interest and knowledge regarding the challenges and disparities in the healthcare industry. So thank you everyone for listening. If anyone has any questions about my talk, please feel free to email me at the below email. Yeah, and thank you everyone for listening. I hope everyone has a great day.